We can talk about what happened on that show. The kind of crazy making is that some of them choose to stay in treatment, which I'm delighted to do, and Rachel is definitely one of those people. And so I continue treating them, but that I can't talk about.
Yeah.
You know what I mean? So it gets a little weird. Hey, man, here's somebody speaking of old friends.
Jason Wahler.
Jason Wahler just sitting down.
But that's interesting. It's a very interesting point.
Yeah.
Because your confidentiality, you got to remain anonymous. You have to remain anonymous, I guess, but if you're on the show, that's okay, right?
Exactly.
Is that how that works?
That's how that works.
Well, you know, she said something really, really cool that I think is a really, really big help to people, is that any kind of substance that you use, that's the phrase, changes your reality.
It sure does.
I love that, yeah.
And the crazy thing about a person's experience in using is that your ability to be objective is altered too, so you don't realize that your perceptions are changed. You just think it's just the way things are, and that's the insidious part about addiction. You know something about that?
Jason Wahler joins us too, who's on Celebrity Rehab as well. Jason, it's an old friend of yours, Dr. Drew, I guess, huh?
Yes, he is. He helped me out.
Talk a little closer on that deal so we can. There you go. Yeah.
There you go. Jason, for instance, fighting isn't something Jason does in his normal state.
No,
but it's definitely something he's into when he's loaded.
Is that it?
When I used to drink, man, I used to just always for some reason want to try to fight. So I don't know why, but that's not me when I'm sober. I'm the nicest guy in the world.
He really is not combative in any way. And then to see him getting arrested it breaks your heart. I imagine your parents feel like, because we know that not to be you, you know?
Yeah, my parents were devastated.
And what does make somebody an angry drunk or a happy drunk?
We don't know. In fact, oh crap, I've got some urgent calls I gotta make. But it's a very, very strange phenomenon. Some people, I remember there's one case I had where he was not an addict, but we gave him like a Valium-like drug for a procedure, and he became violent, flew off the table. So it's just your unique biology and how you respond to the chemistry of these substances.
You never know from what kind of medical pill how you're going to react from that.
That's
side
right.
Effects
That's
and all
exactly
that
right.
Deal. Yeah, that's exactly
right.
Well, Jason, so how long has it been?
You're 210.
210 days.
Yes.
Nice.
You know, see, about the Golden Voice homeless guy, now I want to bring that up.
Yeah.
Tell me what you think of this, because we saw the video clip of him. You saw that too, right?
When he was on the street?
Yes.
Yeah.
Okay, and the guys go by and they film him. He says, yeah, and then they have the interview with him. Did you see that, Jason?
I didn't.
You didn't?
I haven't.
How the hell can you not see that?
I saw it for the first time like 2 days ago.
Oh, is that right?
Yeah.
Okay, well, so he's talking afterwards, and this is what gets me. And he says, yeah, I've had these problems, I've been, drugs and alcohol, but I've been sober 2.5 years now.
No.
Right. Well, red flag. First of all, if you've been sober on drugs
And you're on the street, then it's a bigger problem here.
Yeah, but
you better hope that it's drugs and alcohol that made you homeless, because that we can take care of. You know what I'm saying?
Yeah.
If you're homeless and you're sober, we got bigger problems here.
well, yeah, exactly. Well, not only that, if you're sober, of drugs or alcohol, you know how many days, like my man just said here, it's been, right?
No, that's exactly right. If you actually are in the program, you can have a date. That's how, in fact, if you ever wonder if somebody's serious about their sobriety, just ask them, well, how long have you been sober? And they'll say, well, let me think now. It was January 24th at 4 p.m. was my last drink.
Okay.
Or they'll have the days in their head already.
See, that's a fantastic employer's question.
Yeah, that's right.
You're right. You got one of those deals.
Right.
Exactly.
Okay.
Well, Jason, what's the toughest part for you lately, man?
I'm going to actually step up and take this call real quick.
Go right ahead. That's great.
Yeah, go right ahead and do that, doctor, because that